Welcome, everyone, to the Advocacy Academy Webinar Series. My name is Rachel Wilson from Catalyst for Change. I'll be moderating the webinar. The topic of today's webinar is Breaking Barriers and Building Bridges to Advance Girls' and Women's Health and Rights through Coalitions. Let's see there. Here we go. And we have about 50 participants joining us. And we're going to get started in just one moment. We have people from all over the world and many different time zones. For some it's very early, for some it's pretty late. So thank you for making the time to join us for this webinar. I'm going to begin going through the slides now and introducing our panelists in just one moment. So this webinar is part of Women Deliver's Advocacy Academy. And for those of you not familiar with Women Deliver, Women Deliver is a leading global advocate for that champions gender equality and the health of rights and girls and women. Many people know Women Deliver as one of the largest convenings of champions for women and girls globally at their conferences. The Advocacy Academy is a new advocacy skill building component of Women Deliver's efforts, and it's made up of 3 parts that you can see on this slide. There's an online advocacy training available to those who have registered to attend the conference. There's this webinar series. This is the second of 2 topics, each offered in 3 languages, English, Spanish, and French. The first was on social accountability and community engagement. This one is on coalitions and how coalitions can help to advance advocacy and policy issues and overcoming some of the challenges that come with working in coalition. We'll also be offering a skill building workshop 2 days prior to the conference. It's full now. About 100 people will be participating in that from 50 countries, where we'll be doing some trainings on advocacy skills and then supporting people in engaging with policymakers at the actual conference, and then having an online community. Today, we are thrilled to have 3 really incredible women speaking with us. Each of these discussants is an expert in their field. We first have Mati Dia. She is the partnership manager for the Global Financing Facility for the Civil Society Organization Hub, and she'll be talking a bit about the national coalitions for the Global Financing Facility for RMN, CA, H, and N. Second, we will have Hope Nankunda. She's the founder and executive director of Raising Teenagers Uganda, and she's the Central Region Coordinator of Girls Not Brides Uganda. And she will tell us about their national advocacy. And last, we'll have Evelyn Karijo, and she's the director of YACT, which is Youth in Action Kenya at AMREF Health Africa. And she'll talk not only about an online community that they have nationally, but some coalitions working at county levels throughout the country. Each discussant will have 15 minutes to describe how they have mobilized people using coalition models for advocacy. And while the discussants are talking, we encourage you to ask questions using the chat box. So the way that we'll work this is each of them will have 15 minutes to talk. You should ask your questions in the chat box. We'll be collecting those questions, and at the end, I'll be posing those questions to them. We'll answer as many questions as we can during the Q&A session after each of them present. If there are any questions that do not get answered during that time, we will have the discussants type up those answers and we'll get back to you. Without further ado, I am going to turn it over to Mati. Mati Dia will share how the GFF coalitions nationally have helped to bridge historical division between advocates across the reproductive, maternal, newborn, child, and adolescent health and nutrition spectrum. Really a very valuable and exciting set of coalitions. So Mati, I turn it over to you.
Thanks a lot, Rachel. Very, very happy to be here with Hope and Evelyn. Greetings to all participants. Thank you for Women Deliver as well to organize these webinars. And it's a great to have the opportunity to talk about the GFF coalitions. Just for an introduction, the Global Financing Facility for Women, Children and Adolescents Health is here referred to as the GFF. And it helps low and middle income countries and governments better prioritize investment for health and nutrition for women, children, and adolescents. So far, we have about 27 countries that have joined the GFF, and civil society organizations, along with governments, technical, financial, and the World Bank, have diverse levels of engagement in the process. Just to clarify, I am working on a CSO hub that is hosted at PAI in Washington, DC. This is not working with the bank on the GFF Secretariat, so it's quite confusing for a lot of people, but I just wanted to have this clarified. The GFF has been an opportunity for civil society organizations in a lot of countries to organize themselves, to align, to harmonize their work within coalitions, because within countries we have a plethora of health organizations working on different issues related to RMNCH, reproductive, maternal, newborn, and child health. And with the GFF coming into these countries, most of them have felt the need to align and to come together within coalitions. Some of these coalitions are specific to the GFF, like in Senegal. Some others are have a wider scope, but most of them are very focused on health. Most of them have the same goal, which is ensuring that governments allocate more and efficient resources for better quality health services for all, with a specific focus on sexual, reproductive, maternal, and newborn and child health. And every national coalition will have specific objectives based on their context, of course, and challenges that they're facing. And the size will vary. Some organizations are only composed of 20 to 30 members, like in Cote d'Ivoire, in Malawi. These are very small coalitions, but cater to larger groups. For example, in Cote d'Ivoire, you have a coalition that is very small, but which is linked to other networks. So it's like a hub of different networks within countries, but the coalitions represent these networks. In Kenya, for example, you have HENET, which is a health organization coalition, but has over 200 members. And the composition varies. You have youth groups, you have healthcare professionals, academia, research-based organizations, you have community-based organizations. You also have, for example, in Senegal, there are women's groups who are called like aunties, who work and have a very heavy impact working in communities. So the membership is very, very wide, and these organizations have come together and organized, structured themselves within very specific, how do I say, governance structures. So they have secretariat, they have different working groups within the coalitions based on the needs of the coalitions, and of course the action plan. So you have some working groups very focused on advocacy, communication. Others are working on service delivery, generating demand. Some are working on monitoring and accountability. Some are working on resource mobilization. And as you can see in the picture here, you have within these coalitions several sectors. Some are working on health. We have education. We have several of these organizations, coalitions that have integrated others working on child marriage issues. Some are working in environment, on water, sanitation, and health. So these coalitions are not health focused, but they're working on social determinants of health, which brings in lots of different expertise and alignment for better impact. Slide, please. So now when you look at the outcomes, it's very early to talk about impact on health of women, because the GFF has been launched in these countries. It hasn't been too long, but we are already seeing some results that have been achieved. Some have been highlighted here. One of the major highlight, I think, and from seeing in several countries, is the alignment that we see across several initiatives at country level. This is not institutionalized, but we're seeing people who are working on UHC 2030, people who are working on scaling up nutrition, people who are working on the Gavi and the Global Fund country coordinating mechanisms, the Gavi CSOs, the FP 2020. So there's a lot of alignment happening at country level. And most of these different CSOs, of course, have their specific goals, they have their specific objectives, but what we are seeing is that they're aligning around one common action plan. And one major achievement that we have seen in Senegal, for example, is that the action plan that has been built by civil society, but in collaboration with government, has been integrated in the national investment case, which has been developed by the government partners and CSOs. And it has been budgeted, integrated in the national plan. So we're already seeing things happening. In Kenya, in Nigeria, Tanzania, in Uganda, we have the civil society scorecard looking at accountability and health services, performance of health services and hospitals, health centers. We are seeing increased funding for better health services, which to us it's seen as a major result. We will be talking, of course, about impact over the next few years, but these are some of the key outcomes that have been achieved by civil society coalitions. And there's also a lot of learning across countries. There's a lot of South-South learning between coalitions. Last year, we were able to have a regional Francophone workshop where some countries, newcomers were learning from old countries. And this is where coalitions are learning how to better structure themselves, how to better avoid some of the pitfalls that have happened in the former coalitions. And we're seeing more and more of this South-South learning across coalitions working on the GFF. Next, please. Now, there are best practices that have been documented so far. We have one case study on Senegal. There is another case study on the experience within Côte d'Ivoire, which is currently being developed. And one of the really best practice that we can highlight is the linkages that some coalitions and some sectors who would not work with other sectors before are now seeing the benefit of aligning themselves and how much they can impact health if they work together within these coalitions. People working on child marriage didn't see the strong links that they had working on protection, education, aligning that with health actors. And this is something that is increasingly seen in countries where different sectors work together for the common benefit of the health of women and children. Members mapping, seeing who is doing what where is also helping different coalitions avoid duplication so that the work is done by those who are best fit to do it, depending on where they're located in countries. Trust is also something that takes a long time. And what we've been saying is that sometimes we take at least 10 to 15 consultations for this trust to exist, because we need more information sharing, more coordination and consultation across coalitions. The participation of young people as well is something that has been seen, and we're trying to raise the profile of young people and their meaningful participation across the different coalitions and working groups. As a lesson learned, there are several highlighted here. I think one key lesson that we have, I would say two, is the governance structure. The coalitions that do not have a governance structure are failing to really deliver, because everybody thinks it's someone's responsibility to do the work. So we have seen that it's best to have a clear governance structure to make sure that roles and responsibilities are shared among the different members. Money is a big issue and lesson learned. we often think that we don't need money to function, but this is like the basis to have these functioning coalitions. As next steps, for most of these coalitions is really to work and focus on strengthening the governance structures, mobilizing more funds for coalition work. Most of these coalitions have already developed action plans, but we need money to make sure that these action plans are being implemented. So there's a lot of advocacy around this, and making sure that we document what we see in countries. A lot is being done by civil society, but not enough being documented. So we're trying to make sure that these best practices are documented and are used for South learning, and making sure that also, and I will end with this, to make sure that young people are taking fully responsibility and are integrated in not only the planning of the GFF investment case, but monitoring and implementation as well. Thank you. I will stop there, Rachel. Just for information, these are some of the resources that have been developed by our partners. There are great tools that are available on Mamaye website. GFF accountability scorecards. These are just a few that have been in Kenya, but we have some that have been developed in Nigeria and in Tanzania as well. And there's also a case study on civil society engagement in Senegal, which I have said before. And keep tuning in on some of these websites. You will see some more tools and global goods that will be published. Thank you, Rachel.
Great, thank you so much, Mati. That's really helpful. I think, some of the things that I took away from that is the importance of clear governance structures, that people understanding really clearly what their roles and responsibilities are is key to success, and that you need resources, that it takes time, it takes expertise, it takes commitment, and those roles and responsibilities often don't happen if people aren't resourced for it. And that it takes time, and that trust is a key factor, particularly if you're looking at overcoming some of those divisions or lack of linkages across sectors. So that's really very helpful. I encourage you all to put any questions that you have into the chat box for Mati. We will come to those later. So that will be at the end of the webinar, but we're tracking your questions, so please do put them into the chat box. Next, I'm very pleased to introduce you to Hope Nankunda. She's from Girls Not Brides Uganda, and she's going to share with us some of the lessons learned in building a coalition of over 80 organizations in Uganda that have strengthened the voice of a diverse set of stakeholders to advance district policies and programming to prevent child marriage in Uganda. So I turn it over to you, Hope.
Hello, everyone. My name is Hope Nankunda from Uganda. I lead a team at Raising Teenagers Uganda, and I also coordinate the Girls Not Brides Uganda National Alliance. And I'm glad to be sharing this with you. Talking about the building coalitions, we start with talking about goals and the structure. Girls Not Brides Uganda comes from the global partnership of Girls Not Brides, which is based in London and has a membership of over 1,000 organizations. And these come from over 100 countries across the world, and all of them are focusing mainly on keeping girls in school as a means of ending child marriage. Uganda as a country became an official partnership with the Girls Not Brides Global in 2016, but the alliance started in 2013, and we started with only 8 organizations that time, which was 2013. And the organizations kept adding in and coming in, and the number kept adding in. And right now, as we talk, we have 86 member organizations that are located in different parts of the country. but maybe to be specific, we are in over 60 countries, 60 districts in Uganda. The Alliance of Girls Not Brides is hosted by Joy for Children Uganda, and it's also co-hosted by World Vision. And these hosts make sure that the alliance grows from one state to another. They ensure that the members keep coming in, we receive new members over and over again. But it's also important to note that the leadership of the Alliance has helped it to grow. I want to focus so much on what has helped us to grow. We have a national steering committee that consists of 15 member organizations from different parts of the country. And these help to oversee the activities and the programs of the Alliance. And also to note so much of that is that we have regional champions, and these regional champions help to keep closer to grassroots organizations, because we realize that when we have members from different parts of the country and we are unable to reach out to them and see what they're doing and keep encouraging them or get them closer to the Alliance, many will try to run away or just ignore. But the reason why we looked at having regional champions is to ensure that those that the Secretariat cannot meet on a regular basis can be met by the regional champions. And these are, we have the Central Region Champions, that's us, Raising Teenagers Uganda, where I am happy to be the team leader. And then we have the Eastern Coordinators, that's basically in Butaleja district, and that's headed by a Health Development, Universal Health Development Foundation. We have champions in Western Uganda and in Northern Uganda. And that has really helped to keep the Alliance together, growing from strength to strength. Next slide. Yeah, we believe so much in reaching out to communities, because we know that a lot happens, a lot of child marriage is happening in communities. So our model is basically capacity building, which we conduct quarterly with members. When we do the capacity building programs, the members are able to get new skills, to interact with the members of the community, to work with their local leaders, because we really we try so much to encourage involvement of community level people, which include the parents, which include the teachers in schools, include the local leaders, because when these people are involved, then it is easier for us to monitor and see progress. We also do have the communication systems that have kept the members really closely together, and this has helped to promote wider visibility of their work. Now, when it comes to communication, many organizations do a lot of great work, but many times it is not communicated. So as Girls Not Brides Uganda, we try as much as we can to give members' work enough visibility to the public. We share the work, we encourage members that whatever they do, they have to document and share with the Secretariat. And when that work is shared, we are able to share with the world on different platforms, different websites, which helps membership work to be known by those they would never have known about the work. So when we do the communications, we are able to touch lives of those that we cannot meet physically, because they read about our programs, they read about our work, and they're able to get encouraged. We realize that many girls in Uganda are falling victims of child marriage, but when stories are shared on different platforms, some girls get encouraged and are able to avoid becoming victims. We do joint tracking and reporting of child marriage cases. I think the recent one being about the youngest grandmother in Uganda, which is like even be the world, I think. We found out this when the grandmother was 27. Right now, as we talk, she is 30 years old, and she has 8 children and 2 grandchildren. If we are working to end child marriage, we must be interested in such cases and bring them out for the world to see. So as the Alliance, we work with the grassroots organizations to get this work out, to get these stories, to get the challenges. What is causing this? If a grandmother, if a 30-year-old girl can have 8 children and 2 grandchildren, if something is not done now, we realize that it will not be possible to change the story. So when we capture these stories as an alliance, we use the media, we document them and use them as examples to other girls who we meet in different communities in the parts of the country to encourage them to stay focused on their education, because we know that when they hear such stories, they are able to understand that actually they have a role to play as young people to ensure that they stay in school. Looking at the outcomes achieved as an alliance, we have contributed a lot to the implementation of the national strategy to end child marriage and the national sexuality framework that is currently underway. We work closely with the Ministry of Gender to popularize the strategy and end child marriage in, for example, in Maracha, Butaleja district, Yantonde, Masindi, Moroto, and Kasese districts. Here, these are our partners that participated in our campaign to popularize the strategy, but also bring it to the district level. We realize that if we do not work closely with the government, then we have it all wrong. So we believe as an alliance that it's important to work closely with the government. That is why we have our line ministries knowing our projects and involved in every other activities that we are doing. We also work closely with the members of parliament who also ambassadors in their own constituencies. And when we do this, we are able to send the messages to places where our members cannot reach directly. But when we work with the government and the members of parliament, then we know that the messages are reaching everywhere in the country. I think one most important thing is that just last year, 2018, we hosted the first ever National Girls Summit on Ending Child Marriage in Uganda, which brought together over 400 stakeholders, including young people. And the most important thing here is that half of the people around were the young people. We realize that if we don't bring young people on stage and give them places on the table to share their challenges, then we keep fronting issues that will not be addressed, because the young people know what affects them and how they can be helped. So when we give them a chance to be present and to speak to us, we listen to them and understand their side of the story, and then we help them accordingly. Next slide, please. Some of the best practices by the National Alliance is working in partnership with members of parliament, like I already said, and line ministries. This helps bring issues affecting young people to a national attention, because sometimes when you don't work closely with the government people, you capture the issues affecting the children, but the government, which is supposed to attend to them, if they're not getting these issues directly, then they may not actually attend to them or offer any kind of investment in them. So we work closely with them, and that has given us a very strong mileage. We use the regional champions, like I said before, to keep members aligned at district and regional levels. Then we have joint community outreach programs, which strengthen the capacity of girls and young women. We empower them to fulfill their potential. This is so much important because child marriages happen in the villages. And if we do not do community outreaches and we stay in the city and stay in the big hotels and stay in the AC offices, we are not doing much. So we believe as an alliance that reaching out to communities and touching the actual affected girls, we are able then to register the change that we want to see. We do joint capacity building trainings, which help to strengthen member skills in advocacy, lobbying, as well as resource mobilization. We try that as an alliance, and when we are doing resource mobilization, We get members together, we write proposals together, we give members chances to apply, and we do mapping to see who can implement where, and this has helped to really reach out to different districts, giving members a chance to do the work that they are able to do in time. Then working in partnership also helps to avoid duplication of work. Sometimes when we don't work in partnerships, you'll find that in one district you have about 40 organizations, because today we have so many organizations working on empowering women and girls. So the Alliance, when we work in coalitions, we are able to ensure that we do not all go in one district and leave the other places unattended to. So this has helped us to really map and see that most of different parts receive different services, so that more children or more girls are given the attention that they rightfully deserve. We do orient the new members to manage their expectations. We know that when different people join alliances or coalitions with different expectations, especially to do with funding, sometimes we want members to look beyond funding, because you find that we are both doing different things. So when you join a coalition because you're expecting them to give you money and forget about visibility, forget about capacity building, forget about networking, we have it all wrong. So we manage expectations of members right from the application time. When members are applying to be members of the Alliance, then they are asked what they expect. When we realize that we can't offer what they expect, then we normally give them regrets and ask them to not to join. And I think that's why has made our alliance very much stronger in Uganda. We do quarterly national steering committee meetings to review progress and to ensure strategic planning, which helps to keep us in line. If you have put activities together, you must ensure as an alliance that they are actually met, or members are doing this work, and this helps members to keep connected, helps members to keep sharing what they've done, and keeps us tracked on what is missing and what has not been done, to ensure that we all achieve our set objectives. We also do annual general meetings that keep members in close contact as a way of strengthening the alliance. This is every year, so it keeps us together, and we are happy as one family working together and meeting more regularly to ensure that we are close and doing the work that focuses on ending child marriage in Uganda. Yeah, the next one, Rachel. The lessons learned. We have kept focus by accepting. When we choose to say we are ending child marriage in Uganda, then we insist on that. If a member applies and they are on a different goal, we give them no regrets and say we are focusing on this. So when you keep focus as an alliance, it helps you to have a group that is believing in one goal, and we all work to ensure that that goal is reached. This helps to amend the challenges that are widely divide members' priorities and expectations, because if a member is expecting something different and then you get them into an alliance which is specific on ending child marriage, they'll end up grumbling and complaining. And so we keep the focus. If members are not working on our goal, then we do not encourage them to become members. I think that's why that's what has kept our alliance very strong, because we are very specific. Then our organizational status, we have specific requirements. When members are applying to be members of Girls Not Brides, they must be legal. We ask for specific documents that show that actually they are legally registered, they are legally approved by the government, by the country, that districts are aware that this organization exists, which also helps us to avoid having briefcase organizations, those who will say they are registered but they're not anywhere. So even when we go to do mapping, we are able to know that this organization is actually in existence, and that has really helped us to keep solid as an alliance. And our next steps, We continue to work as an alliance significantly to reduce the rates of child marriage in the country, which is currently stands at 40%. About 5 years ago, it was at 70. So I must say that we are doing our best, and working together is what has caused all this change. And we are still very positive that it's just a matter of time. We shall be able to bring these percentages much, much lower. We align with other like-minded coalitions and networks. We know that if we are working on ending child marriage, if another network is working on health or human rights, we know that if we work together with them, then we are all directly contributing to the development process. So we also work in line with other networks that work to protect the rights of girls, and that way we are able to continue focusing on our goal of ensuring that every girl achieves their full potential. One of the other steps is, of course, growth. Growing, we want our alliance to grow and enroll more members during the campaign to end child marriage in Uganda. We know that the numbers are not small, but also we know that organizations that are coming up and everywhere in every part of the country have something to contribute towards ending child marriage. So we continue to look forward to receiving more members to apply to join the alliance and ensure that we become a much bigger family that is working to end child marriage in the country. And as I wind up, Rachel, think on resources. We worked on, we use different resources to support our work on ending child marriage in Uganda, like you can see there. Thank you so much for listening to me, and thank you so much, Rachel, for the great work. Thank you.
Well, thank you so much, Hope. That was really very, very informative. You know, we heard again how important structure is to a coalition, roles and responsibilities. We heard about the fact that there's orientation and quarterly meetings and annual meetings and communications so that people are continually engaged, and the importance of the regional structure so that there is reach out into the communities and engagement with grassroots groups to be able to highlight some of these cases and really engage at a community level. We also heard about the importance of capacity strengthening and the trainings in providing the skills to people who are in those communities to be able to advocate on their own behalf and to tell their stories. We also saw the importance of focus, of engaging only those people who have a focus on ending child marriage, and that's a way to overcome some of the challenges and diverse goals. So we've learned a lot from you, Hope, so thank you for that. I encourage you all to continue to put your questions into the chat box, both for Mati on the GFF as well as for Hope on the Uganda Girls Not Brides. And next, I'd like to introduce you to Evelyn Karijo. She's the director of YACT, Youth in Action Kenya, at AMREF Health Africa. And she'll discuss the role and models for strengthening youth advocacy networks across a diverse set of counties in Kenya, and how the Meaningful Youth Engagement Scorecard has helped to improve the effectiveness of youth engaging with policymakers. So with that, I will pass it over to you, Evelyn.
Thank you, Rachel. In Swahili, we say asante sana. Now picture this, getting into a room filled with young people working on a common thing. They could be designing the next biggest technology innovation or brainstorming on a joint statement to the president. The energy, the excitement, the hope that comes with youth working jointly regardless of the field is always unique. That's our everyday feeling at YACT, Youth in Action. We are a uniquely youth-led, youth-driven program in Kenya, an initiative of AMREF Health Africa. Now I'll tell you a bit about our genesis, which is on the next slide. Next slide, please. So in Kenya, about 70% of the population is below the age of 35. This large and growing population brings with it great potential to contribute to development. Unfortunately, as youth, we have unique challenges that hinder the achievement of our full potential. I have outlined 3 unique challenges that we face. One is vulnerability to sexual and reproductive health challenges. For example, 1 in every 3 girls in Kenya gets pregnant before the age of 18. Secondly, higher rates of HIV infections, and of course, sexual and gender-based violence. The second is that we have so many youth networks and organizations existing with very limited structured mechanisms to help us connect, align, and strategize with one another to advocate for common policy issues. The third is that we do not have adequate skills, tools, and resources to engage policymakers, since a lot of advocacy skills are not taught in our education curriculum. So what have we done to address these challenges? On the next slide, next slide, please. We have formed Y Act Youth in Action to address these challenges. It's been close to 2 years now since we started in 2017. And as I said, we are a uniquely youth-led program. We have a youth steering committee here in Kenya. Our goal is to ensure that policies and resource allocations at national and at county level reflect and support youth priorities. And we focus mainly on sexual and reproductive health and rights and gender equality. Our coalition model, as you can see on your screens, is at 2 levels. At national level, we work mainly online. So we got the youth to create this innovative online portal to identify youth organizations and youth priorities. Initially, we had a target of about 20 organizations, but then the response that we received from the youth was overwhelming. We've been able now to mobilize opportunities to over 3,000 youth and more than 700 youth-led organizations in Kenya. The second level is at county coalitions. At county level, we've been able to select organizations representing each region in Kenya. As you can see there, we have the urban region, pastoral region, coastal region, and rural region. So we've supported the development and mobilization of youth-led coalitions in each of these regions. I just want to mention that at national level, we did not just get youth organizations to register on our platform. We used a criteria online that had questions on where the youth organizations were located, on the advocacy work that they did, whether it was on family planning, nutrition, education for girls, etc. We checked whether they were registered as required by the government. We checked whether they were female-led or male-led, and whether they addressed priorities of key populations. At county level as well, in selecting each of these counties representing the different regions, we used data on SRHR indicators in Kenya, and that's how we're able to select each of the 4 counties representing the urban, pastoral, coastal, and rural region. So that's our model in Kenya. Next slide, please. So what's our approach like? Our coalition approach is to increase the capacity of youth to work jointly in coalitions and to have a common voice on priorities in SRHR and gender equality. So we have 3 key pillars: providing youth with skills, the voice, and a platform for participation in policy processes. So Y Act uses advocacy learning tools that are available on mobile platforms and in person. These tools were developed by the youth and have very exciting case studies and animations based on real experiences from the youth. Secondly, we have provided the online platform that I talked about earlier and coalitions for youth voices to be heard. And thirdly, we use accountability mechanisms focusing on meaningful youth engagement in policy-making processes. Meaningful youth engagement, and in short, we call it MYE, is one area that we have found quite interesting. One of the things we realized is that MYE is not documented and tracked. Policymakers stated that they wanted to engage the youth in policy processes, but they didn't know which mechanisms would resonate well with the youth. On the other hand, the youth were eager to be engaged by policymakers, but then no opportunities were being provided. So we got the youth in our national online coalition to define elements of MYE, and through that we developed a scorecard, which you can find on the list of resources at the end of my presentation, and of course standards for the use of this scorecard. Now what's unique about the MYE scorecard is that it's used and filled in jointly by policymakers and the youth. So they see it and document how policy processes and policy outcomes are all inclusive and are better as a result of engaging the youth. Next slide, please. So what outcomes have we achieved? At national level, we have achieved so much with the online movements that we set up. We've been able to carry out campaigns, online campaigns, and actually mobilize the youth online to give their views to policymakers on what they would want included in policy documents. So we've been able to advocate for inclusion of youth priorities in the national youth policy, specifically on provision of adolescents and youth-friendly services in health facilities, and ensuring meaningful youth engagement in policy committees at various levels. At county level, as you can see outlined, we've had quite a number of achievements within 2 years. In Nairobi County, for example, the youth have been able to ensure that there's 50% youth representation in policy committees, specifically one that right now is developing the county adolescent youth sexual and reproductive health and rights framework. In Kilifi County, as you can see on the photo there, the Minister of Gender is actually advocating for increased finances for youth and gender in her dockets. In Samburu County, which is a pastoral region, we have successfully advocated for the prioritization of an anti-bidding chapter in the school enrollment and retention policy. This is something that wasn't there before, and this is something that's going to lead in a reduction of early and forced child marriage, and of course, teen pregnancies. In Kakamega County, we have ensured that youth are included in the youth-related components of the sexual, gender, and based violence policy, and we now have a standalone youth policy for SRHR. Next slide, please. So what's worked and why has the advocacy by youth been successful? Coalition building. So policymakers are now eager to work with WIACT. Why? Because it's a coalition of youth networks who have identified common priorities. So they're not getting young people coming to their offices every day with the same priorities and at different times. They're eager to work with a coalition and a movement of youth who are very clear on the priorities aligned across different organizations. Secondly, WIACT has been able to work jointly with policymakers. The new skills that the youth acquired enabled them to have greater partnerships with policymakers than in the past. The youth have been able to foster champions within governments who are actually now resources and have ultimately achieved stronger advocacy outcomes. Third is on the advocacy strategy development support. Earlier on, I talked about skills in advocacy. So right now, as a result of stronger strategy development skills, youth advocates have been able to understand the entire process of policy making better and have been able to approach decision makers with actionable policy solutions. The last is on accountability for meaningful youth engagement. What has worked really well is having policymakers and youth scoring jointly and tracking and documenting meaningful youth engagement in various processes. Next slide. So what are some of the lessons that we have learned, the challenges, and how did we mitigate them? First, competition for visibility amongst youth-led organizations was mitigated by the use of a common brand. So we ensured that youth-led organizations in this coalition used the WIACT brand to avoid the whole issue of competition for visibility amongst a big number of youth-led organizations. Secondly, we used existing data to mitigate aspects of youth organizations selecting priorities with buyers. So the use of existing data at county level ensured that members actually agreed on a common set of priorities. Third, there was a lot of demand by policymakers for guidance on how to engage youth, as I earlier mentioned, but they also wanted youth to be accountable for the engagement with policymakers. So through the scorecard, we have been able to ensure that both policymakers and youth are being kept accountable. So what's next for WIACT? We're going to mobilize 3,000 youth advocates and over 700 youth-led organizations to support targeted campaigns on gender and SRHR at national level. We also want to now focus on creating a bigger impact on youth outside major cities and those from marginalized and key populations. Secondly, we want to continue tracking and documenting the outcomes of the Meaningful Youth Engagement Scorecard and sharing these at a wider platform and at a larger scale at national level and with committees with authority over priority youth issues. Next slide. So we have included 2 resources for you. On our website, you'll get to read some of the stories of our youth advocates on our advocacy diaries, and then the Meaningful Youth Engagement Scorecard and a summary of our WIACT wins are included in the second resource. What you can see on your screen are screenshots of the Meaningful Youth Engagement Scorecard. It's been designed by youth to ensure that it's something that resonates with young people and that policymakers can also find interesting as well. So thank you very much, and I look forward to any questions and comments.
Well, thank you very much for that, Evelyn. We heard a lot from you about WIACT, about also using capacity strengthening as a tool, similar to in Uganda, where building the capacity as you're running the coalition and managing it. Also about the innovations in terms of the Meaningful Youth Engagement Scorecard and the use of coalitions having tools to hold their policymakers accountable to the commitments that they're making, as well as the fact that you are using youth-driven approaches to identifying the priorities in each of the counties and having ways for those youth to learn from each other and having some very specific outcomes that you have pursued and achieved. Also very interesting about the demand and the need and the desire from the policymakers to engage with the youth and understand better how to do that, and also holding the youth accountable for their engagement. So a lot of rich learnings from you as well. We've got a lot of questions that we have received. What I'm going to do is ask the panelists to address some of those questions. And so I'm going to start with, there's a few different themes here. Some are around financing, some are around structure, some of them are around process. So I'm going to group some of these questions. The first is a bit about structure. And one is, there's a couple of questions. One is about how do you manage a partnership structure? And how do you support the shared management model? So I'm going to ask you, Hope, first to start, maybe talk a little bit about how you are specifically structured. Are you considered, and another question is whether you're considered an organization, whether you're registered as an organization, whether there are individual organizations within the coalition. So if you can just say a little bit about whether you're registered as an organization, what is a bit of your partnership structure? So what is the role of the members? And a little bit about, there was one person asking about shared management models because you have such a distributed structure. And then I'm going to ask you also to touch on the financial components and whether members pay. So a little bit about structure. Hope, I'll start with you. Hope, are you there? Can you hear us?
I can hear you, trying to get, okay. About registration, we are registered, we are affiliated as the Girls Not Brides Global. It's a national partnership. In Uganda, we work as one coalition or one alliance that is specifically registered under the Girls Not Brides Global Partnership in London. So in Uganda, the different members work as are registered as individuals. Can you get me?
Yes.
Yeah, the individual organizations are registered as their own organizations but belonging to the alliance. But for official registration of the alliance, it is a national registered partnership affiliated under the Girls Not Brides Global. But whereas we also, when we do our campaigns or do our work, we are doing in different parts of Uganda. And then what was the other question?
There was a question about shared management models. So when you have distributed leadership across the country, someone was asking about that, and how do you manage that? Because that can be challenging sometimes when you've got shared leadership across different parts of the country.
Yeah, our shared leadership across the country is managed through our quarterly meetings, because when we say that different regional champions are managing different areas or different regions, we have a time in a year, like every March, every July, every October, when we need to put our heads together and compare different regions and what is happening there. So the regional champions help to make sure that individual grassroots organizations are not left out. They are kept together at a regional level. So it has not been a challenge, it has instead been an advantage as opposed to a challenge, because when we come for national steering committee meetings, we are able to get to understand what is happening in different parts of the country, which would be difficult if we did not have regional champions to keep close monitoring of grassroots organizations where most of the work is taking place.
And can you also say whether when you do these trainings and campaigns, do you do them at a national level or at the community-based level?
We do both at national level and community-based level. But most of those that we do are in the community, the outreaches, because like I said, most of the child marriage issues are happening down in the villages, down in the rural Uganda. So we try to get together as partners, and we move out different regions and reach out to these girls directly, without sending, without saying that if a member is in Western Uganda, they should do the work there alone. So the reason why we do the community events is to add our energies together and work as one solid group. And when we go, we don't only meet the girls, but we also are able to meet the parents, we are able to meet the local leaders, we are able to meet the teachers. We divide ourselves in different groups that we use the same outreach to touch different types of stakeholders as we front our campaign to keep girls in school.
Great. And do the members pay to be members of the coalition? That's another question.
Yes, members pay they pay a membership fee to be members, and this membership fee helps to run some of the activities of the alliance. For example, if we have to do monitoring of new members or orienting new members, the alliance doesn't have specific funds to do this. So if members do not contribute, it would be difficult to do some of the little activities that we do. So we ensure that members attach value to be a member, and that alone can encourage them to really stay focused. So they pay to be members. They don't only pay at the beginning. After they have paid at the beginning, there's also annual subscription fees. So that even when we are giving out, if, for example, we have joint campaign, joint fundraising, and we want to give out, consider members who are going to implement, members who are given priority are those that are fully paid up members. This encourages other members to really stay on the same pace so that we are all paid up and able to get all the opportunities that every member is supposed to get.
Great, thank you. And to Matti, I have a question here for you about the cross-sectoral approach. Will you talk about all of these impacting health, but they wanted you to share any specific successes in cross-sectoral work and how that works. So can you share with us a specific example of how in one of the countries they bridged across those health sectors and how they were able to do that?
I can share the example of, this is not a GFF example, it's actually a coalition work on child marriage in Senegal, where you have the health sectors and the education sectors coming together, not only to raise the age of marriage and advocate for to raise the child, to the age of child marriage, I'm sorry, to 18 for girls and boys, but also to revise the family code and also to implement some tools, effective tools in communities and in schools, which were developed both by the Ministry of Health and the Ministry of Education in collaboration with a national platform against child marriage to work on making sure that the girls are going to school and they're in safe places and they are being taught about their rights within their communities and within their schools with child safe spaces. So this is, we can't reach the results yet because this has been going on for about a year, but we see the same happening in Cote d'Ivoire regarding nutrition, for example. When we first started working with the coalitions, nutrition was not always integrated systematically, and now it is part of the action plan. And we're having several actors in nutrition designing and integrating indicators in nutrition within the wider action plans, which, of course, within the next year or two, we can start looking at impact and results. But right now, it's very, very early because these coalitions have started about a year and a half ago.
Great.
But I have shared earlier on the chat box a publication which I hope we can display. It's a publication showing cross-sectoral work and studies that have been developed by the Partnership for Newborn Maternal and Child Health, PMNCH, and these show real examples of cross-sectoral collaboration which show impact in different countries. There are two of these publications. I think these are great models to start with, to see as an example. If everyone can access the chat box, then you can go and access these.
Great, and I just reposted those in the chat box, so you should be able to access them there. Just to let you know, a couple of people are asking whether the recording will be available. It will be available, and we will send that as well as a copy of the presentation to all of you who have attended. I have a couple of questions for Evelyn. The first question was around what methods you use to set priorities and develop a strategic plan. So you've got a lot of youth with a lot of different priorities. How do you work with them to prioritize which issues you address, maybe both at national level and in counties?
Thank you, Rachel. The first thing is to identify the youth-led organizations that have common priorities. For example, in our case, we had organizations that had priorities alongside aspects of education for girls' child education, others on family planning and nutrition. So forming coalitions that are based on the priorities is the first thing. And then secondly, use data. For example, when it comes to health and SRHR, which is quite broad, what are the issues that the coalition needs to prioritize? Using data ensures that youth-led organizations are able to identify common sets of priorities and that they're actually coming up with evidence that they can present to policymakers, and they can quote reports that have been done within their specific context. How to develop the strategies, of course, now using the problem tree, and I'll still use the same example. On SRHR, for example, if you're looking at teenage pregnancy, what will be the issue? Is it that there's inadequate awareness on various SRHR services provided in health facilities? Then what will be the reason for that? Probably there is no policy or guideline existing to ensure that health facilities avail this information to the young people. So having identified and gone through the problem tree, you're able to come up with the actual action that's needed, which is setting up a policy or a guideline to ensure that SRHR services are provided to young people. Then the next thing is to identify the person's target at policy and decision making. If it's the lead for the health department, it could be your governor, and then now sitting down as a coalition and coming up with specific messages, packaging your evidence and data well as a coalition ensures that you're able to propose actionable solutions to the policymaker. So in summary is getting a coalition to align with a certain priority using data, using the problem tree and advocacy techniques to be able to come up with actionable solutions to propose to the policymaker.
A couple more questions for you. One was what age you're referring to when you talk about young people, and then also what are some of the biggest structural barriers to engaging young people in the policymaking process on SRHR?
So the definition of age varies with different regions. In Africa, we follow the AU Charter and the definition of young people, which is the ages of 18 to 34. And the reason for this is that young people in this side get to access development quite late within their life in comparison with the Western region. However, organizations like the UN define the youth age bracket as 19 to 24. So in our case, in Kenya, we follow the Constitution and we follow the AU Charter. So we're looking at 18 to 35 as the youth population. Then the next question on structural barriers. The very first one and the biggest one that we've seen is inadequate capacity, where as youth, we do not have adequate skills and tools to package our message well, to even carry out advocacy, because advocacy is not taught in schools. It's not part of our education curriculum. Policy processes as well. So a lot of jargon that's included in the policy process is not easily understood by young people. This is one big structural barrier. How do we ensure that as young people, then we have the skills and we're able to demystify what's being discussed by policymakers and that we're able to articulate our issues effectively to them? So capacity is one. Second is working in silos. We've seen so many youth-led organizations emerging in Kenya, and not just in Kenya, across the region, but most of them want to work in silos, probably because of competition for funding. So how do we ensure that we convince youth-led organizations that working as a coalition is more effective, they bring better outcomes? The best thing is to keep documenting what we are doing, for example, at WIACT, and telling people to join coalitions, not necessarily at WIACT, but any youth-led coalition within the country and at national level for bigger impact. Thank you.
Thank you. Thank you for that. And I also have a question now for Hope. One question from Nigeria. Do you face resistance from religious or community leaders? This is common in Nigeria, but that was a question in how you handle that. Hope, I'll unmute you there.
Hello?
Yes, we can hear you.
Okay. Is the question about religious leaders?
Yeah, do you face resistance in your work from religious or community leaders? That's from someone in Nigeria who is saying that they are facing those challenges.
Yeah, I must say we have really faced some resistance, especially in terms of the sexual, the SRHR implementation in schools, because some of them say that the information is it's not for the young people in schools. But what we've tried to do as Girls Not Brides Uganda is to get religious leaders into discussions, because many times they'll give their views, but they have not listened to, or no one has talked to them, no one has got them in the room to explain to them why this information is really coming out and why it is very important. So we work towards getting them in the room, we get into discussions with them so that we are able to explain to them why it is important to involve the young people. Because if we do not tell young people in schools, right now we see most of the young, even below 10 years, girls are involved in sexual activity. So when we involve them, they are able to understand and they do not resist meeting us to talk to us. That is the beauty. So we have a feeling that it's a matter of time and they really understand why we must reach out to the young people and teach them on how to keep themselves safe.
Thank you. And then for Evelyn, a question around, particularly around SRHR and how you manage to get your information out and involving young people in these issues without clashing with government or religious leaders is a question that we just got asked by one of the participants. Evelyn, can you touch on that at all?
Yes, various platforms to get our information out. And when it comes to SRHR, the best thing is to form partnerships across various stakeholder movements. So one, coming in as a coalition gives you greater impact. Then having conversations with the government and actually showing that our best interest is to get the priorities of the youth are included in policy and how that will affect the development of the country, makes sure that policymakers actually listen. For religious leaders as well, we've had conversations with them, and in Kenya we've seen a positive response from religious leaders. For example, the Muslim Council just launched their comprehensive sexuality education curriculum tailored for the Muslim, they call it madrasa classes. And this is because they're actually seeing from the data the negative effects of not having policies and information and services reaching the young people. So first starting with data, showing the evidence and showing how this impacts the lives of young people is the first step. Then having conversations with policymakers, with religious leaders, and getting them to see why it's important for them to have platforms and policies that ensure that young people get SRHR services is the second thing. So that's how we've been able to get information out and achieve advocacy outcomes.
Thank you. And I have a question that probably goes to all of you. You know, the fact that members are often funded to work in specific areas and with competing financial priorities for the members, how do you get them to work outside of what they're funded to do? And maybe I'll start with you, Mati, and because you are having some of, you know, you're really bridging across some of these sectors working together. Is that a challenge where how people are funded to work in their specific area? And is that a challenge, and how do you overcome that?
Thanks, Rachel. It is a challenge, but I think, like I said during the presentation, trust and confidence takes time within coalitions, and competition was one of the biggest challenge we had. Competition for funding, competition for visibility and branding. And once you've passed that, it takes, when I say time, it can take up to 1.5 years or 2. And in Senegal, we have been able to bypass this by you know, going through some trainings on how to mobilize resources as a coalition based on the action plan agreed upon by the coalition members. And though there are limited resources for each of these organizations, we are able to target donors that fund coalition work. And there are more and more donors out there who would fund coalition work, who would prioritize coalition work over some other individual organizations' work. And it doesn't always work, but I think one of the successes that we've had, this is not only in Senegal, but in other countries as well, is that transparency is set from the start. When there is a funding opportunity, everyone knows about this funding opportunity. And if the coalition decides to go and apply, the members who would be interested will also say, raise their hands and say, I am applying, but knowing that they are at risk of not getting the funds, knowing that these funds might be going to the coalitions. So this has been a challenge, but we always share the information to everyone. And I've been able to support some coalitions develop proposals which are for the coalitions and not for individual members. But this competition work will not, I don't think it's going to go away, but it's just a matter of having, you know, dedicated members for the success and sustainability of the coalition, because they know that as coalitions, they have more credibility and legitimacy to get funding from some donors.
And I think that's actually a question that a number of people have asked, is maybe each of you can say a little bit about how are you funded to do your coalition work? And I think, Matti, you just talked a little bit about how the funding is, but anything you want to add to that, Matti, in terms of how they're funded to do the work?
Now, some of the coalition members have been putting their own money, and even for some coalition members who already had funds from donors for the individual organizations, they have been able to discuss and get funding, the same funding that was for their organization, reallocated to the coalition's work. And I can cite one organization that has done this in Senegal, another one in Cote d'Ivoire. And they will take, of course, by dialoguing with the donors that they have, that this work is for the coalition. This has been able to increase some funding for the coalition work, but it's really very, very small amounts of funding. So you have members who who provide money to their own coalitions, but you also have very few, but you have some donors out there. PAI, through the GFF Civil Society Hub, is funding coalitions work through small grants, through technical support. And I can also provide information in the chat box regarding the CSO Hub, the Civil Society Hub. PMNCH has been able to provide small grants for coalitions work at the GFF, and working in coalition with the GFF Secretariat. So there are donors out there. You also have Amplify Fund. You have small donors that are providing funds for sexual reproductive health. It's just a matter of finding out where the money is and making sure that you have an action plan that's ready with at least a logical framework or a result framework. So when the proposal comes out, you don't have 30 days to develop. And this has been one of the challenges that I would like to raise within coalitions. They don't have an action plan ready or a concept note ready. And by the time they realize there is a funding proposal, they all have to meet, and meet the deadline and develop this proposal. The deadline has already passed. So this is something that I would also recommend for coalitions to have this ready within their own structures.
Great. And maybe Evelyn and Hope, you can also say a little bit more about funding. Evelyn?
Thank you. I just want to concur with a lot of what Matti has put across, and specifically just checking first where the opportunities for funding are, if it's in SRHR or gender or youth work or strengthening Indigenous women, for example, and then preparing proposals for that. What we've seen working in our case is where youth-led organizations apply for this funding as a consortium. Within WIAT Coalition, we have organizations funded by different donors, sorry. But we've seen instances where some of the youth-led organizations apply for funding as a consortium regardless of previous donors, and they're able to align different sections of the proposal on their different expertise. It's providing tools and resources on advocacy. There's some who are good at budget advocacy, for example. So we've seen our consortiums working very well within our sector. Thank you.
Great. And Hope, a little bit more. I know you said that there are some dues. Is that primarily how the coalition is funded?
For Uganda, we normally do joint resource mobilization. And that's sometimes we do proposals. For example, we've been funded before by Amplify Change. They supported our work as a coalition, and this was done, the proposal was written jointly. We had members of Girls Not Brides Global Office come here to help and empower members on how best to put proposals together, because even maybe sometimes coalitions fail to get funding because we don't write the right way. So that support, the Girls Not Brides Global, helps us to keep growing. But even when that is not so common, that we have joint grants coming in, we emphasize that every member makes a contribution towards the work. And that's what I call the joint resource mobilization. When we have community outreaches, for example, we ask member organizations to make contributions from their own budgets as organizations. So we raise money from different organizations and fund our own selves to go to different parts of the country and do these outreaches. And that has helped our work to keep going, without saying that if we don't have grants from donors, therefore our work must stop. That's one thing we've tried to avoid as an alliance in Uganda. We believe that we have the capacity to do the little we can with the little resources we can, whereas while we wait for the bigger donors to find us on the way moving. But also membership fees from people, from the member organizations have helped us to run the alliance and to make sure that the Secretariat doesn't feel so tired of running this, because normally secretariats face the biggest challenge when there's no funding. But when the membership fees come in, they're able to facilitate some of the quarterly meetings, they're able to facilitate some of the visits to different organizations to do capacity building, or to do the mapping and to ensure that these organizations actually exist. So that is how we have been able to manage it, emphasizing that even when we don't have the bigger grants, work must go on, because child marriage will not end if we don't even do the little that we have as individual organizations. So even when we do the strategic plans and action plans, the members are given these plans to fit in their individual work plans as individual organizations. So you find that every organization has a budget for the alliance, because we want the organizations to contribute to the alliance, also the alliance to contribute to the organization. So we are all building each other at the end of the day.
Thank you. Well, one thing that I'm very impressed with in all of you is the fact that the members are finding enough value and prioritizing the coalition work sufficiently to be able to contribute their own resources or even realign their resources. I think what that really shows is that each of you has created a coalitions or supported coalitions that are a real value added to the members. And so congratulations to all of you for doing that, because the crux of a coalition is to be of value to its members and find common ways of supporting that. We need to move on from the questions to hear a little bit about the satellite sessions that Women Deliver would like to highlight. But I'm very grateful to the discussants who have just shared some very rich information with us. I'm going to ask Jessica from Women Deliver to tell us a little bit about the satellite events that Women Deliver is holding.
Hi, great. Can you hear me?
Yes, we can.
Okay, great. Yes, so my name is Jessica Rowland. I'm a senior associate here. Thank you to everyone who participated this morning. Here at Women Deliver, we are currently gearing up for the 2019 conference, which will be the world's largest conference on gender equality and the health, rights, and well-being of girls and women. One of the elements of this conference that we care most strongly about is that it spurs a global dialogue and helps amplify the voices of organizations and individuals around the world who are doing essential work in this space. One way that we feel privileged to do this is by partnering with organizations as they host satellite events. Satellite events are events that take place in communities around the world leading up to, during, and after the conference. They can be organized by NGOs, individuals, universities, corporations. Formats are flexible, and examples can be anything from panel discussions to film screenings, receptions, viewing parties. They can be as large as a festival of 5,000 people or as small as a lunch discussion made up of a team of your own employees. Thematically relevant events, which you have already on your calendar, can also be branded as satellite events. So why host a satellite event? By registering as a satellite event, you access the opportunity to amplify your voice and your organization as part of the conference dialogue, and to brand them as part of a global movement on the path towards a more global gender equal world. Once accepted, your event will be featured on the Women Deliver satellite event page. You will also receive a toolkit and ideas around publicity and partnership, receive the right to use a Women Deliver branded logo, and by utilizing the WD 2019 hashtag and other social media tools, you will broaden your scope and expand your publicity. More than anything, you will generate excitement for your event by marketing it as an international dialogue around the health, rights, and well-being of girls and women everywhere. If you are interested in organizing a satellite event, it would be our privilege to work with you. Please feel free to ask any questions you may have, and we look forward to hearing from you.
Thank you so much, Jessica. Well, I want to thank everyone, particularly the discussants, for sharing their incredible work, and to all of you for taking time out of your day to join us. We had, I think, over 50 participants on this call, which is great. We hope you've learned something new and been inspired with some of these innovative ideas. We will make these available to you once we've edited the recordings, and you will be invited, once you leave this session, to take part in a very brief survey. We ask that you do complete that survey so that we can make sure that these webinars are as relevant and valuable to you as possible. We want to continue to improve them so that they meet your needs. Again, thank you to everyone for taking the time. I hope the rest of your day or evening, as it were, goes well, and we'll share this with you shortly.